me I'm the only one that you love. Life could be a dream, sweetheart. Hello, hello again. Shaboom, and hopefully we get old. Life could be a dream. If I could take you up in paradise like flowers. If you would tell me I'm the only.
Hey everyone, how's it going? My name is Yakov. I am a second-year medical student currently. Today I have the honor and privilege of shadowing John, my fourth-year roommate, on his emergency medicine rotation. You may have actually met John in the previous emergency medicine rotation video, but if you haven't seen that, I recommend it. Check it out. Today we're going to be at a different emergency room, one that's closer by, so I'm actually walking. In case you can't tell, it is absolutely freezing outside. It's 31 degrees. I'm wearing 4 layers. But hey, if you love it, you do it.
Somebody looking to save some lives.
So that was actually John. He had to zoom by because he has to get there a little earlier than me. Okay, so we are in the emergency department now. We're about to see our first patient. What's she presenting with?
Yeah, so she is a younger person who's coming in with right lower quadrant abdominal pain, as well as right sided flank pain as well.
Right, so some of the top things that you have to think about are appendicitis, right? Right lower quadrant pain is pretty typical for appendicitis, but the fact that she also has flank pain indicates that there might be some kidney involvement, so you have to worry about an infection of the kidney called pyelonephritis. We'd also have to worry about kidney stones.
And then also, you know, in reproductive age females, you always have gynecological issues that you're concerned about. Ovarian torsion is the one in the ED that you are kind of really concerned about, or maybe a ruptured ectopic pregnancy. And then a ruptured ovarian cyst, and kind of reproductive complaints can be in the lower abdominal quadrants.
So we're gonna take a look and let you know how that goes.
Yeah. All right, so we just got back from looking at some of the results for our patient with abdominal pain, and it turned out the ultrasound of the kidney showed that she had kidney stones.
Kidney stones, two kidney stones.
Yeah, so that's small enough that we're not concerned that she won't be able to pass them, and thankfully she didn't have any signs of infection. So thankfully she was able to go home.
Yep.
So up next, we're about to go see a person with an occupational exposure of chemicals to the eye. The eyes are something that are so important for life that you want to be extra careful. We're going to take a look. She's already irrigated her eyes, but we're going to see what else we can do.
Definitely. Okay, so we just saw our patient. The eye looked pretty good. Her vision was intact, but just to be safe, we called the Poison Control Center. I don't know if you've heard of the Poison Control Center, but you'll see it on the backs of toothpastes and other common products that say, you know, if ingested, contact the Poison Control Center. So we actually called the Poison Control Center, and they are so nice, so knowledgeable. They told us exactly what to use to irrigate the eyes and for how long. They looked up info about the chemical that she was exposed to, which we had never heard of before.
Yeah, and what's really cool is we, as fourth years, spent a day up there. So I probably knew and met some of the people, some of the pharmacologists in there, as nice in person as they are over the phone.
Right.
So
super friendly people.
Sending nothing but positive reviews for our local Poison Control Center.
1-800-222-1222. That's the number. All right, so next we're gonna see a pediatric patient who's presenting with some headaches. Let's take a look.
So we just got back from seeing our patient with headaches. You know, she has a pretty complex medical history with some developmental issues, but her headaches seem to be kind of out of the blue. Their episodes, they come out of the blue and then they go away out of the blue.
Yeah.
We talked to the pediatric neurologist, and she said it doesn't seem like it's something that's acutely enough that she needs to see her right now or an emergency, so she'll be able to follow up with her.
Yep. Okay, so next up, we're going to see a patient with a recent diagnosis of gastric cancer, which is cancer in the stomach. She's received 1 day of chemo and is presenting with bloody vomit. And so that could be pretty concerning, so we're going to take a look and see how she's doing. All right, so we just saw our patient with a recent diagnosis of gastric cancer. She was with her family, and unfortunately she is suffering a lot. There were tears in the room. It was a really hard moment. I got her family members something to eat. I got her a warm blanket. We're gonna order some blood work, get her some anti-nausea medications. But one thing that I did want to say is that it'll sound really cheesy, but sometimes getting a patient a blanket or getting a worried family member a sandwich feels as good, feels as rewarding, and as important as actually taking care of the patient in terms of like medicine. And so these small acts go a long way. The family was really appreciative. Okay, so that's a wrap for today's ER shift. I hope you enjoyed the video. If you did like the video, be sure to hit that like button, subscribe to my channel, and leave any comments or concerns down in the comment section below. I will be sure to reply. Until next time, bye-bye.